is a very important month for many reasons, but right now we're talking about Skin Cancer Awareness Month, and here with tips on how we can protect ourselves from the sun. Summer is coming up pretty quickly, and help prevent skin cancer is board-certified dermatologist and co-host of The Doctors. Welcome back, Dr. Sonia Batra.
Welcome.
So skin cancer is the most common cancer in both men and women, right? Most preventable.
Exactly.
Most curable.
Most
when detected early.
Absolutely.
I almost sound like a doctor when I say
You
that.
sound very knowledgeable.
Right? What are the three most common?
So the three most common, first off, is one called basal cell carcinoma. So far and away, the most common skin cancers are the non-melanoma type. They just don't get the same press. There are over 3 million diagnosed each year, and they actually aren't the ones that the typical ABCDs apply to. They're completely curable if caught early. So the basal cell is usually a pearly pink bump, often like a pimple that doesn't go away, a sore that continues to bleed. Far and away, the most common, about 80% of non-melanoma skin cancers. The second one that you'll also hear about is something called a squamous cell carcinoma. That one usually comes up like a sandpaper reddish, scaly, crusty spot, sometimes a sore. Sometimes it can grow very quickly, so you can even have these volcano-like eruptions that come up. That's one like that. And then the third, of course, we have to mention is melanoma. And just this past Monday was Melanoma Monday. And the reason people talk about it so much is because even though it's not very common, about 178,000 in the U.S. will be diagnosed this year, by far the most lethal. So melanoma is one that if you catch it late, unfortunately has the ability to metastasize or spread elsewhere. And that's the one that's pigmented that you have to watch for in your moles. So typically when we talk about that, that's where you come in with the ABCDs that people are often taught.
Right. So the ABCDs, if we are conducting our own skin cancer self-exam, I suppose, what should we be looking for?
Yeah, so the A stands for asymmetry, which means that you just can't fold it in half so it looks the same on either side. So if you were to draw a line through it, it wouldn't match one side to the other. And so this is a really nice graphic for that. The B stands for border. So we always talk about a crisp, well-defined border, something that's jagged or irregular, sort of bleeding into the surrounding skin. Not a good sign. So you want to look for a crisp, well-demarcated border. The C stands for color. So we talk about a kind of uniform color is a good sign. Something that has different shades of color, not so great. So if it has shades of brown, red, blue, white, sometimes black, that's another thing to watch for in your own moles. And I'm so glad you mentioned self-exam, because that's something I emphasize so much to my patients, because you know your skin better than anyone. And about 50% of the time, true melanoma is just going to rise out of the blue. So it's not something necessarily in your pre-existing moles. The D stands for diameter. We always talk about 1/4 of an inch, which is the size of a pencil eraser. So if you notice something getting bigger than that, or that comes up out of the blue that's about that big, that's something to watch for. And then the E is a newer one that stands for evolving. So something that's changing in color or shape, that's getting bigger, that's something that you should also be aware of. And that's why if you are keeping track of your skin on a regular basis, whether ideally once a month, hard for some people, more like once a quarter, really important if you see something that's changing, or certainly something that comes up out of the blue.
But with those ABCDEs, if you have one of those or two of those, does that mean that you would have cancer? Or is it just, it could maybe just be a mole that's just doing that?
Exactly. So those are guidelines. And sometimes I will have people who come in and they meet every one of those criteria, but thankfully it's a completely harmless spot.
Good to know.
So it's not that if you have something that meets all these criteria, it's definitely cancer, but you should have it checked.
But if it doesn't, and Paige, wasn't your mom didn't meet those criteria, right?
Well, she went in and, no, none of these, A, B, C, D, or E. She had a sore on her inner shin. There she is in the middle there. And it didn't heal. So she kept going back to the doctor every few months and said, "What's in there? Like, you're older. It'll happen. You know, the older you get, the longer wounds take to heal." And so it was about a year that she had, and finally got to a skin, one of you, a skin doc. But she texted me while I was here, said, "Yes, it's cancer."
Oh my goodness.
It's like in a text, Mom. And I feel like we're so trained to look for the moles. We never thought to look like, we thought she hit her leg like a dishwasher or something.
And so you're right, because that was very likely a non-melanoma skin cancer. So much more common, like I said, over 3 million. She likely had something called a squamous cell carcinoma based on what you're describing.
That sounds right.
And so those are the ones that are sores that don't heal. peel, a crusted spot that never quite goes away. My litmus test is about a month, so a year is way too long. So even if you're older, if you have a spot that's just not quite resolving, and even if you don't remember traumatizing it or you feel like it just never healed after that injury, such a good idea to have it checked. And then surgically can be completely cured if you take it out.
It was, yep, she had surgery and she didn't have to do any chemo or radiation, so that was good.
My dad had the basal cell a couple times, and so I get really nervous, and I love the sun. So I try to put on sunscreen as much as possible. But what, you know, the guidelines I feel like change. I get confused. What should you look for in the sunscreen? That's really important.
No, that's a great question. And so what I always tell my patients is look for an SPF 30 because that's about a 97% UVB block. So when you're looking at an SPF, you're only looking at one part of the ultraviolet spectrum. So also really look for something on the label that says broad spectrum. That means it's going to cover both UVA and UVB. And I'm sort of a fanatic about the mineral sunscreens that have zinc or titanium because they're much less allergenic. They sort of sit there on the skin as a physical shield and they deflect ultraviolet. So there's no chemical reaction, great for kids, great for people with sensitive skin. But the key thing with sunscreen, actually, even more to your question about what to look for, is that people just don't use enough of it. So when you read that SPF on the label, when they're doing that assay, they're actually thinking about you applying a shot glass full to all your exposed areas. So if you're putting on your sunscreen, you're probably not putting on enough to get that SPF. And so
That's a lot. And you're not reapplying.
And,
like,
and
your makeup, you're like,
absolutely. And so that's when sometimes having other things like a spray or a powder that has SPF to layer on top every couple hours if you're just out and about, every hour if you're in water, really important.
What other tips would you recommend, doctor?
So I'm a huge fanatic, especially I practice here in Southern California. I have kids. Protective clothing, such a good idea. So rash guards, if you're at the beach, look for something called UPF in your clothing, which is like an SPF for fabric. It means that the fabric has zinc in it. So many fabrics will have UPF rating of 50, like some of these rash guards here. Those are actually my kids' rash guards. And then broad-rimmed hats, something with a 2-inch rim. You may not go this nuts with it, but just something that's going to sit there as a physical shield.
Well, they happen to be very chic, these hats.
Yeah, they're kind of trendy right now.
I have the boys out doing yard work on the weekends with me. When do I want to get them out?
Right,
in the sun?
true.
Like, what is there a time?
So generally before 10 a.m. or
That ain't
after
happening.
2 p.m. but remember,
After 2 is probably
if
the
your
window
shadow is shorter than you, that means you should be in shade because that's a really good kind of marker.
If your shadow is shorter than you, you should be in the shade.
Exactly. And it's just a good way to know what the UV index is like. It's a good rule of thumb that if you look down and your shadow is shorter than you, that means you should probably not be doing outdoor garden work or out golfing. Or
I can't get them out of bed before 10.
Before 10, then
after
You're not going to see the shadow.
That's not good care for me because they'll be complaining, Dad, thank you so much.
Thank you so much, doctor.
Thank
So
you for
wonderful.
having me.
Such great information.
Appreciate it.
Paige, I hope you're wearing your sunscreen because you're up next.
Oh, I am. Yes, every day, thanks to Sonia. What we are doing is making palace doors. It is perfect for the queen inside of you. Come on back.